Should I introduce you?
It's okay.
Is the protocol chair for HPTN 052, associate Chancellor for Global Health and Director in North Carolina, and of course, but is the driver, the driving force behind 052. Myron.
Thanks for the introduction. Well, we're excited to be here today, and I won't take 5 minutes. This afternoon, what's interesting is thanks to the generosity of IAS, we've heard a lot about this study, but it's actually never been presented to a scientific audience. And so for us, it's a great opportunity to show you the data that led to the conclusions that have kind of were press conferences have preceded actually anyone seeing the data. In addition, the manuscript, 2 manuscripts relate to this. One will be released online today in the New England Journal of Medicine, the main manuscript with a very large supplement with the data. The second manuscript shows the virological linkage that's critical to the interpretation of the results. That will be released in the journal, that'll be published in the Journal of Infectious Disease, we believe, in August. So, but today's, the main manuscript should be available at 4 o'clock online. At the session, we'll have opportunity to present 4 things. We'll present our prevention results, and we'll show you how we came to the conclusion that the treatment we provided serves as terrific prevention. We'll show you how linkage is done, because it's not so simple, and we think it has to be done extremely well in order for the results to have validity, veracity. And so Susan Eshelman will present those results. We'll present you data from regions around the world as it relates to virology and immunology. So we had the privilege within this study of having 13 sites in 9 countries, and it lets us look at disease progression or treatment in Asia, North and South America, and Africa. It's overweighted towards sub-Saharan Africa, but it allows us some very unique comparisons that we're excited about. And lastly, the study design of 052 is such that there's really an independent clinical trial built into it. So we have the treatment as prevention trial, which we feel very strong about. But in addition, we had the opportunity to do a randomized controlled trial of treatment randomized to 350 to 550. That's our immediate arm or our early arm, randomized to treatment provided between 200 and 250, with very narrow range of the treatment starting, the median CD4 counts and such. So you'll see essentially a second randomized controlled trial presented within the context of 1 session. So we look at this as an opportunity, sort of for us, an opportunity for the first time, because IAS was generous with us and said, you may present your results at this meeting, and so we have not presented them anywhere else, and this is a terrific opportunity. So we'd like to thank IAS, and we really look forward to the session.
Thank you. Thank you. That's, the questions will come later on for all. Now I think it's Michael will present the TDF2 study, which is a different study, but works to fill this issue very well.
Great. Well, thank you very much, Dr. Vela. And just want to take a moment to congratulate my colleagues with the Partners PrEP study and the 052 study for their remarkable work. Before I present the TDF2 findings, I'd like to start by saying that this is really an exciting time in HIV prevention. With the emerging news of PrEP you'll hear today, combined with the IPREX results from last fall and the recent groundbreaking findings from the HPTN 052 on treatment as prevention, there's little doubt about the power of antiretroviral-based HIV prevention strategies. And before this week, we only knew that PrEP could work for men who have sex with men. But now we have evidence from 2 clinical trials showing PrEP is effective among heterosexuals as well. This is significant and welcome news for the population hardest hit by the HIV epidemic. Turning to CDC's TDF2 study, I want to first acknowledge the Botswana Ministry of Health, who was our strong collaborator throughout this important clinical trial, as well as the researchers at our trial sites and, very importantly, the trial participants for their time and commitment to this study. The TDF2 study enrolled more than 1,200 HIV uninfected heterosexual men and women between the ages of 18 and 39 years of age from the general population in 2 cities in Botswana. Participants were randomly assigned to take a placebo pill or a daily antiretroviral pill containing the drugs tenofovir and emtricitabine, known by the brand name Truvada. All participants were provided with comprehensive HIV prevention services, including male and female condoms, behavioral counseling to reduce HIV risk, and testing and treatment for sexually transmitted infections. Women were also provided with hormonal contraception, and those who became HIV infected during the course of their study were immediately referred for appropriate care. The results of the trial provide strong evidence that PrEP is safe and effective at reducing HIV infection among heterosexuals overall. In the primary analysis of 1,200 HIV-negative participants, there were 9 infections in the, among participants who received Truvada and 24 infections among those who received placebo. This translates into a 62.6% reduction in the risk of HIV infection, and this finding was strongly significant. In addition, we conducted a separate analysis of efficacy among participants known to have a supply of study drugs to better understand the level of efficacy among trial participants believed to be actually taking study medication. This analysis excludes any HIV infections that occurred more than 30 days after the participants' reported drug dose, because those individuals could not have been taking study medication at the time of their infection. We found protection was even greater in this population. There were 4 infections among those assigned to the study drug arm and 19 in the placebo group. And this translated into a 77.9% reduction in risk, again with a strong statistical significance. Consistent with other PrEP studies, our preliminary analyses did not identify any significant safety concerns associated with daily PrEP use. In addition, among participants taking Truvada who became infected after enrollment, there were no cases of resistance. There were also no significant differences in overall adherence based on pill count or reported sexual risk behavior between the 2 study arms. In terms of next steps, CDC has 3 immediate priorities. 1, we are conducting additional analyses of the study data, and we'll report them as they're completed in the months ahead. These will include analyses of efficacy based on the level of adherence to the study regimen based, as measured by pill count and self-report, as well as analyses of the protection associated with measurable levels of the medication in the blood. 2, as part of our original study design, we're planning open trial provision of Truvada for all participants for 1 year. And 3, CDC will fully review the data from all heterosexual trials to begin to work with partners to develop interim guidance for use among heterosexual men and women in the United States. Dr. Kevin Fenton, director of CDC's National Center for HIV/AIDS, viral hepatitis, STD, and TB prevention, is also here with us today and can address any additional questions you may have about CDC's next steps during or after the Q&A of today's press conference. And before I close, I want to take a moment to acknowledge the contributions of the National Institutes of Health for providing supplemental funding, and Gilead Sciences, who donated the study drug. And as I said at the beginning, this is a very exciting time for all of us in HIV prevention. And we now have several options within our toolkit to be able to use, to be able to affect the HIV epidemic worldwide. Thank you.
Thank you very much. So our next speaker will be Baeten, and he will talk about the Partners PrEP study, another milestone. Thank you.
Thank you very much. First off, on behalf of myself and Connie Kellum, who's the protocol co-chair with me of this study, we're very thankful to the conference for the opportunity to present here. We are just aware of these results 8 days ago from the Partners PrEP study, hence handwritten name tag, because we are here. We thank the conference organizers and the incredible 052 team for being able to share time with us today, and congratulations as well to TDF2. The Partners PrEP study is a phase 3 randomized double-blind placebo-controlled trial of tenofovir versus emtricitabine tenofovir versus placebo for the prevention of HIV as pre-exposure prophylaxis among HIV-negative persons within HIV serodiscordant partnerships. At an ad hoc DSMB review on the 10th of July of this year, the Partners Prep DSMB recommended first that the results be publicly reported, and secondly, the placebo arm discontinued immediately due to an overwhelming and clearly convincing effect that PrEP reduced HIV risk in the study population. For the study, we enrolled 4,758 serodiscordant couples from 9 incredible trial sites with collaborators in Kenya and Uganda. During the course of follow-up, participants were randomized to one of the 3 study arms and all received a comprehensive package of HIV prevention services, including intensive risk reduction counseling individually and as a couple, condoms, treatment for sexually transmitted infections, and referral for antiretroviral therapy and other HIV prevention strategies as per national policies. During follow-up, conduct of the study was of the highest level. Follow-up in the study and retention was 95% throughout 36 months of follow-up, and adherence to study product was over 97%. Primary study results are as follows. During the course of study follow-up, 78 HIV infections occurred, 18 in the tenofovir arm, 13 in the emtricitabine tenofovir PrEP arm, and 47 in the placebo arm. This translates to a 62% efficacy for HIV prevention for those receiving tenofovir and 73% reduction in HIV risk for those receiving emtricitabine tenofovir. Both of these results were highly statistically significant, and the DSMB recommended reporting of these results a year and a half earlier than was anticipated because of the statistical robustness. We also, as found in previous PrEP trials, found that PrEP was safe. Our immediate next steps have been to discontinue placebo arm participants from active product, and they will thereafter be offered active PrEP. Our 2 active study arms have been continued in the study at the recommendation of the DSMB to continue to gather comparative information between tenofovir and emtricitabine tenofovir PrEP for the prevention of HIV. The difference between these 2 arms was not statistically significant in the study. We're very excited to be able to be presenting here and feel that this, presenting along with HPTN 052 and the TDF2 study, really opens up new avenues for HIV prevention with high impact. The combination is very important. Thank you.
So I thank you very